Well, step-down care means your child is no longer on an ICU level status, which is a good thing. That means your child is feeling better.
You no longer need that one-on-one level critical care, but you're not quite ready to go to just a general pediatric floor.
There's no difference in quality of care between the pediatric intensive care unit and the step-down unit. The difference between the intensive care unit and the step-down unit is that you have a little bit less monitoring from a nursing care standpoint, but you still remain on monitors so that we can closely watch your child's vital signs.
The physicians will change some. There are hospitalists that work on the acute care unit, and there are intensivists who work in the ICU. But they communicate all the time, and so the care will be exactly the same.
The major difference too is that you will hopefully see less machines in your child's room. You also will be able to hopefully look at your child and say, this looks like my child at baseline. They look like they're feeling better, they're able to play.
Just because you're moving from that ICU level and it was one-on-one, our staffing ratios are still very similar. Our step-down ratios are 3-to-1, but just because the nurse might have a couple extra patients to go look at, we also have additional staff that are coming in to see you guys, whether it's the RTs coming in or if it is the clinical associates, child life therapy. You'll still have people in the room.
The patients are less critical and don't need as frequent monitoring, but the nurses are skilled and trained, and the physicians are also skilled and trained. Nothing will fall through the cracks.
Typically in the step-down unit, the physician rounding team comes around between the hours of 9 and 11 o'clock.
Rounding is another one of those words that can feel confusing. And all that means is the same thing in the ICU. You will be meeting your entire team.
The physicians, the nurses, the respiratory therapist will go room to room and round and kind of talk about the total plan of care for the day. And this is a great time. So if you're available in the room, we always will ask you to come out and join us. And that way, if you have questions, we can answer those questions for you.
The step-down unit is a little bit quieter than the intensive care unit. Your child is on the monitor, so you still may have some bells and whistles going off, but typically it's a lot less than the intensive care unit.
The step-down area, the rooms aren't quite as big as the ICU because we don't need as much additional equipment brought into that room. But there are private bathrooms, they're all private rooms, they all have the best monitors in each room.
They also may be able to visit our activity center now too, if they're allowed to still engage in their favorite things, crafts, painting, anything that they would like to do. We encourage you sleeping in and rooming in with your child in the step-down unit. This is because your child knows you best and you know your child best.
And we need their help in knowing what their child prefers, what they like, what may scare them.
Here at WVU Medicine Children's, you're going to receive the best care, whether you're in the intensive care unit or the step-down unit.
The most important thing I want them to know is that your child is going to be incredibly cared for and comforted.
We're going to care for your child like they're our own, and if there's anything that concerns you, we want you to speak up.
Going from ICU to step-down care, the biggest thing is to know that it's a sign that your child's one step closer to home.